Hi, everybody. You are listening to the Medea podcast series. Medea Medical Education Academy is a global medical education provider dedicated to designing, delivering, and evaluating medical education programs worldwide. Today, we will be speaking with Laurie Berstein, Professor Emerita in the Department of Pediatrics and past director of the IMD Nutrition Clinic, section of clinical genetics and metabolism at the University of Colorado School of Medicine, Denver, and Children's Hospital Colorado in Aurora, Colorado. At the end of the podcast, learners should identify the challenges of an adolescent brain with PKU management, discuss the current recommendations on independence around diet management, and identify hot and cold cognition. This podcast is part of the continuing medical education program entitled PKU Blended Learning Journey 2025, targeting specialists in pediatric and adult inherited metabolic disorders, dietitians, nutritionists, clinical biochemists and geneticists, basic scientists, psychologists, gynaecologists and obstetricians, nurses and all healthcare professionals helping those with PKU. All materials will be suitable for all geographic regions.
Hi, my name is Laurie Berstein, and I am a professor emerita in the School of Medicine, Department of Pediatrics at the University of Colorado, which is affiliated with Children's Hospital Colorado. I'm past director of the IMD Nutrition Clinic in the section of clinical genetics. I'm also a managing partner for MedEd, which is a nonprofit dedicated to training healthcare professionals globally in the nutrition management of inborn errors of metabolism. I am a fellow of the Academy of Nutrition and Dietetics and a 5-time recipient of the Academy of Nutrition's Creative Nutrition Education Award. In 2024, I had the honor of being awarded the Phyllis Acosta Lifetime Achievement Award by GMDI, the Genetic Metabolic Dietitians International Group. I am proud to be a co-founder of Metabolic University, a training forum for registered dietitians, nurses, genetic counselors, and medical doctors, and a founding member of GMDI. I am a co-author for many educational modules for families with inborn errors of metabolism, and I am the co-editor and author of the textbook Nutrition Management of Inherited Metabolic Diseases, Lessons from Metabolic University. Today, I'd like to give you an overview right now of PKU, which is a rare inherited metabolic disorder that significantly impacts a child's brain development if left untreated. Here is a breakdown of what happens. PKU is caused by a defect in a gene that produces the enzyme phenylalanine hydroxylase, also referred to as PAH. This enzyme is crucial for breaking down phenylalanine, an amino acid found in protein-rich foods. Without functional PAH, the phenylalanine hydroxylase, phenylalanine accumulates in the blood and critically in the brain. The high levels of phenylalanine are toxic to nerve cells in the brain, and this accumulation interferes with normal brain development and function, particularly during these critical early years. This is the most common and devastating consequence of untreated PKU, which is severe intellectual disability, which, depending on when treatment is started, is often irreversible. Children experience abnormal electrical activity in the brain, creating seizures, involuntary shaking, unusually small head size referred to as microcephaly, and problems with movement and coordination. High phenylalanine levels can also affect the production and balance of important brain neurotransmitters like serotonin and dopamine, noradrenaline, which all play roles in mood, cognition, and behavior. For myelination, there can be alterations in the cerebral myelin, the protective sheath around nerve fibers that is essential for efficient nerve impulse transmission. So there's importance of early treatment. Fortunately, most babies in developed countries, but not all countries, are screened for PKU shortly after birth, usually doing a heel prick blood test. If PKU is diagnosed early, A strict, lifelong low phenylalanine diet can be implemented immediately. This involves avoiding protein-rich foods and using specialized phenylalanine-free formulas. With early diagnosis and consistent adherence, which I'll talk about in a moment, also I refer to as sustainability to the special diet, most children with PKU can have normal intellectual development and avoid the severe neurological complications. But even with treatment, phenylalanine levels need to be regularly monitored to ensure they stay within a safe range, as subtle cognitive deficits can still occur. So, in essence, untreated PKU starves the brain of essential resources and poisons it with excess phenylalanine, leading to severe and irreversible neurological damage, again, if untreated. So, early detection and strict dietary management can largely prevent these devastating effects, allowing children with PKU to lead healthy and fulfilling lives.
What happens to the brain with a child with PKU?
PKU significantly impacts the brain, especially during those crucial development stages in childhood, as mentioned in the overview. The core problem is the inability to properly break down the amino acid phenylalanine, leading to its accumulation to toxic levels. So children with PKU who lack or have a deficient enzyme called this PAH, this enzyme is essential for converting phenylalanine, an amino acid found in protein, into another amino acid called tyrosine. High levels of phenylalanine are directly neurotoxic, meaning they are harmful to brain cells. So without proper PAH, phenylalanine builds up in the blood and critically crosses the blood-brain barrier, accumulating in the brain. The impact on the neurotransmitter system is that phenylalanine competes with other large neutral amino acids, including tyrosine and tryptophan, for transport across the blood-brain barrier. So tyrosine, which is an amino acid, is a precursor for dopamine and norepinephrine, and tryptophan is a precursor for serotonin. When phenylalanine levels are high, it blocks the entry of tyrosine and tryptophan into the brain, leading to a shortage of these crucial neurotransmitters. These neurotransmitters are vital for a wide range of brain functions, including mood regulation, attention, memory, motivation, and cognitive processing. Their imbalance contributes to many of the neurological and behavioral symptoms of PKU. Myelin, which is the protective fatty sheath around the nerve fibers, allows for rapid and efficient transmission of electrical signals in the brain. High phenylalanine levels can interfere with the formation and maintenance of myelin, so this leads to white matter abnormalities, often called dysmyelination or demyelination. The impaired myelination can disrupt communication between different brain regions, and this contributes to cognitive deficits. So, what do we see? We see slower processing speed and motor difficulties. So, even in children who are diagnosed early and follow their diet, there have been studies that show subtle but significant impairments in executive functions, which may be common, and these functions are primarily controlled by the prefrontal cortex, which is highly sensitive to phenylalanine levels. So this can manifest as attention deficit hyperactivity disorder-like symptoms, so difficulty focusing, impulsivity, hyperactivity, working memory problems, so difficulty holding and manipulating information, planning and problem solving difficulties, and cognitive inflexibility. The good news is that with early diagnosis through newborn screening and strict lifelong dietary management, a low-fee diet often supplemented with specialized formulas, the severe neurological damage of PKU can be largely prevented. Children who are consistently well managed can achieve normal or near normal intellectual development.
What are the particular issues facing teenagers and young adults with PKU?
Adolescence presents a particularly challenging period for individuals with PKU, even those who have been diagnosed and treated since birth. This stage of life is characterized by significant brain development, increased autonomy, and intense social pressures, all of which complicate PKU management and impact neurocognitive and psychosocial outcomes. But if you think about this, the prefrontal cortex is one of the last brain regions to fully mature, with development continuing well into the mid to late 20s. This delayed maturation creates an imbalance with other brain regions, particularly the amygdala, which develops earlier. So, how does this impact behavior? Because the prefrontal cortex is still developing, adolescents may struggle with, again, this impulsivity, so acting without thinking through the consequences. Risk taking, engaging in behaviors that have potential negative outcomes. Emotional regulation, difficulty controlling strong emotions, and poor judgment, making decisions that are not well reasoned. All of these impacts on behavior are really difficult, especially when you have chronic management of a disease. The amygdala imbalance, which processes emotions, is more active during adolescence. So the weaker prefrontal cortex struggles to regulate the strong emotional impulses generated by the amygdala. This imbalance is a key factor in the heightened emotionality and risk taking often seen in teenagers. So, experiences during adolescence can shape the development of the prefrontal cortex. We recommend healthy activities such as engaging in challenging tasks, learning new skills, and developing social connections, which can promote healthy brain development. In essence, the adolescent brain is a work in progress, with the prefrontal cortex lagging behind other brain regions. This developmental gap contributes to the unique characteristics of adolescent behavior. Understanding this process is crucial for parents, educators, and anyone working with adolescents.
What is the impact of PKU on feelings?
So, PKU can have a significant impact on individuals' feelings and emotional well being, even when the condition is managed with a strict diet from early life. These emotional challenges stem from a combination of direct biological effects of phenylalanine on the brain and the psychosocial burden of living with a chronic restrictive condition. The primary way PKU affects feelings is through its impact on neurotransmitters, the chemical messenger in the brain that we discussed regulate mood, emotion, motivation, and cognition. So phenylalanine competes with tyrosine, which we now know is a precursor to dopamine, for transport to the brain. When phenylalanine levels are high, less tyrosine enters the brain, leading to reduced dopamine production. Dopamine is crucial for feelings of pleasure, motivation, reward, and emotional stability. So, therefore, low dopamine can contribute to difficulty experiencing pleasure, low motivation, fatigue, both mental and physical, and irritability, a heightened sense of frustration or annoyance. And then there is the serotonin imbalance. Because phenylalanine also interferes with the transport of tryptophan, the precursor to serotonin, serotonin is a key neurotransmitter for mood regulation, sleep, appetite, and emotional balance. And these imbalances can lead to feelings of sadness and hopelessness and loss of interest, excessive worry, nervousness, and tension, rapid and unpredictable shifts in emotional state. If you look at norepinephrine or noradrenaline, which is derived from the dopamine, these are involved in alertness and focus and stress response. So its dysregulation can contribute to emotional instability and difficulties with stress management. High levels of phenylalanine are directly toxic to brain cells, potentially causing subtle damage that affects the neural pathways involved in emotional processing and regulation. particularly in the areas like the prefrontal cortex and the amygdala, which we discussed a little bit earlier. The need for meticulous meal planning, constant labeling, reading, and regular blood monitoring can be incredibly stressful for both the individuals with PKU and their parents and their caregivers. The worry about the Phe levels, the anxiety of keeping Phe levels within a safe range, and the potential consequences of going off diet can be a constant emotional burden. And the shift from pediatric to adult care, where individuals are expected to take full responsibility for their management, can be overwhelming and contribute to anxiety. There's a lot of dietary burden and frustration, the feeling of restriction and monotony, guilt and shame, the lapses in dietary adherence or sustainability, which are common, especially in adolescence, can lead to feelings of guilt, shame, and self blame. And one of the things you've heard me do is substitute adherence for sustainability. And why do I do that? Adherence is a term that we use so much in chronic management and especially in diet management. But adherence is very sticky, it's a very judgmental word. And if you look at the definition, it's about doing the right thing as prescribed. That's a very difficult concept when you think about something that's lifelong. Sustainability is about the ability of something to last and strive in the long term. I believe it's a lot less judgmental. It opens the door for human error. It recognizes that not any of us can do the same thing day in or day out without going off of something. So, like saying, I'm never going to eat chocolate again, and then thinking, is that really possible? No. Well, diet management for patients with PKU is the same thing. It's really the long run that we have to look at. So, when we use words like adherence, our patients have even told us that it sounds so judgmental, which is why I substitute sustainability for adherence. Managing a rare chronic illness can affect a person's self perception and identity, sometimes leading to lower self esteem or a sense of being defined by their condition. We have to recognize the complex impact of PKU on feelings is crucial. Comprehensive management for individuals with PKU should always include, yes, strict metabolic control to minimize the biological effects, psychological and psychiatric support as needed, if available, and family and peer support to help navigate the psychosocial challenges. But we have to address both the biological and psychosocial aspects. Healthcare providers and families can work together to help individuals PKU achieve not only good physical health, but also optimal emotional well being.
How do hot and cold cognition impact the management of PKU?
So, if we look at first the definition, what is cold cognition? Cold cognition refers to cognitive processes that are relatively free from strong emotional influence. It involves rational, logical, deliberate, and reflective thinking. It's often associated with tasks that require problem solving, memory retrieval, planning, and abstract reasoning. So, we want whole cognition, we think about it as calm, like dinner at home, sitting around the table with your family. And how does that influence our patients and their decision making? Versus hot cognition, which some people describe as the clinic experience or peer pressure. Hot cognition refers to cognitive processes that are significantly influenced by what? Emotions, desires, impulses, and motivation. It involves thinking that is more immediate, automatic, and often driven by the pursuit of a reward or the avoidance of punishment. So, hot cognition is emotionally driven. It's influenced by feelings, desires, peers. It often occurs rapidly without conscious effort or extensive deliberation. It's highly sensitive to immediate environmental cues. So think about a teenager going out with their friends, going into a car ride, everybody smoking cigarettes. Should I smoke? Shouldn't I smoke? Next thing you know, they're influenced to do something because it is peer pressure. Well, a PKU patient going into a pizza parlor. Should I have this pizza? I know I'm not allowed, but all my friends are having it. And they make a decision to do that because it focuses on present rewards or immediate consequences rather than long-term outcomes. So deciding to eat a piece of cake despite being on a diet, reacting angrily to a perceived insult, making an impulsive purchase. So it really involves all of our lives. So hot cognition and cold cognition are not mutually exclusive. They constantly interact and they influence each other. So when we're talking about making decisions, most important decisions often involve a complex interplay. So whether we're deciding on a career path, that involves cold cognition. We want to analyze. But then again, it's a long, hot cognition. What feels fulfilling? What sparks passion? They don't work independently, but in chronic management of a disease like PKU, especially with diet management, the adolescent's brain's propensity for hot cognition, impulsivity, peer influence, emotional reactivity can make sustainability to chronic disease management plans very challenging because effective strategies often involve trying to cool down the situation by providing structure, clear logical reasons, and external support to bolster cold cognitive processes. In essence, cold cognition represents our capacity for rational, deliberate thought, while hot cognition, often seen in the adolescent world, reflects the powerful influence of our emotions, desires, and immediate context on our thinking and behavior.
How can parents help their children with PKU?
Parenting a child with PKU is a unique and lifelong journey that requires dedication, knowledge, and a strong support system. The key is to manage the condition effectively while also nurturing the child's overall well-being. So, how can parents help? Strict dietary sustainability, well, this is the cornerstone for PKU treatment. But most importantly, understanding the diet, working closely with a specialized metabolic dietitian to understand the low phenylalanine diet, learning how to calculate Phe, measure food, and identify safe versus unsafe foods. Ensure your child consistently consumes their phenylalanine-free formula or medical food. And if they're not, having the discussions as to why they're not and finding ways to work with them because this is their primary source of protein and essential nutrients. Meal planning and preparation. Difficult for many families to become adept at planning and preparing low protein meals, but maybe doing it as a whole family can really support this lifelong journey. Also, having foods available can minimize temptation and make the diet feel less isolating. How to label read or adapt recipes or have snacks available. And then there's regular monitoring, the blood spot collection, the clinic appointments, education and advocacy, continuously learning about PKU, new research, and emerging treatments, being the advocate for your child. And teach family members, friends, babysitters, teachers, and school staff about PKU, its importance, and how they can support your child's dietary needs. I think it's important to continue to provide clear instructions so that your child can participate in school lunches and parties and field trips. The emotional and psychological support is really important. Recognize that living with PKU can be emotionally taxing for both the child and the family, and validating feelings of frustration, anger, or feeling different. Creating a safe space to talk about feelings, the diet, and social situation. And while strict, It is most important to normalize the diet, to integrate the diet into the family life as seamlessly as possible, and focusing on what your child can eat, not just what they cannot eat. Focus on strengths. Encourage your child to develop interests and hobbies outside of food. They are more than their PKU. It is important to build self-esteem through their accomplishments and talents. And if these things feel difficult or challenging, the most important thing is to seek professional support and connect with other families. Promote independence and self-management. We talk about age-appropriate responsibility, and we really want to make sure that as the child grows, gradually involving them in their PKU management is one way the families can work together. And toddlers can choose their own formula flavors, help measure out snacks. School-age kids can help with meal planning. But when we get to adolescence, what we need to do is to slowly increase ownership. We don't want to all of a sudden turn over responsibility, because remembering that the adolescent brain is not really ready to handle that. So yes, formula preparation, helping with blood spot collection, and starting communication with the medical team independently, that all works. And it's important for successful transition to adult care. But sending all the responsibility to the adolescent all at one time is really a recipe for failure. Help your child develop strategies for navigating challenging social situations relating to food. I just want to reiterate that PKU management is a lifelong commitment. Consistent control of Phe levels is essential to prevent long-term cognitive and neurological issues. So staying informed about new treatments and research, and consider participating in advocacy efforts is always important. Prioritizing well-being, and that remembering that while managing the diet is paramount, the child's overall physical, emotional, and social well-being is equally important. Parenting a child with PKU is truly a marathon. It is not a sprint. So by being informed, proactive, and supportive, I think parents can significantly empower their children to manage their condition successfully and thrive.
Can you comment on the future of PKU?
I think the future of PKU treatment is looking very bright, with significant advances beyond the traditional strict dietary management. While the low phenylalanine diet remains the cornerstone of care, particularly for newborns and children, new and emerging therapies aim to offer more flexibility, improved patient outcomes, and potentially provide a cure. So we see enhanced dietary management and nutritional products, pharmacological therapies, which are currently available and emerging, and of course, gene therapy. Our role as professionals need to continue to be kind and informed. We need to look at the whole person, not only their diagnosis. We need to stay aware and involved in the research so we can advocate and educate for our patients and their families.
Thank you for listening to this Medea podcast. For more information about our continuing medical education programs, please visit our website at medeaacademy.com.